Can I feel a perforated septum? Well, that depends on what we mean by feel. Patients with septal perforations will often feel that the nose is dry. They may have crusts that build up in the nose that they feel they need to clear. And they also may have a sense of whistling or a change in the shape of the nose that may kind of prompt them to know that they have a perforation present. The septal perforation can often be palpated too with a finger, although I highly recommend against you putting your finger in your nose to feel the perforation because you may damage the sensitive lining of the nose and actually cause the perforation to become infected or increase in size. So the short answer is you can feel symptoms of a perforation and you often can feel the presence of it digitally, but I recommend that you have a physician do a full evaluation to diagnose the size of the perforation and its severity as soon as possible.